Assalamualaikum and very good day to all. Okay, we are group number 4 and today we will present one case about adenocarcinoma of the cervix after pregnancy. Before that, let me introduce my team member. I'm Sharifah Mahfuzah binti Said Mahzad and my team Muhammad Hari Aizat bin Abdul Halim and Nur Shahidah binti Taryurman. Next. Okay, these are the important things we are going to talk about. Introduction to the disease, risk factor of the disease, patient history, laboratory analysis, cytopathology features, patient management, and conclusion. Okay, first of all, let's refresh in general about the anatomy of the cervix. The cervix is the lower narrow end of the uterus worm. The cervix connects the uterus to the vagina. They call birth canal. The cervix has two main parts, the ectocervix and endocervix. The ectocervix, we also call exocervix, is the outer part of the cervix that can be seen during the gynecology examination. The ectocervix is covered with thin flat cell called squamous cell. The endocervix is the inner part of the cervix that forms a canal that connects the vagina to the uterus. The endocervix is covered with column-shaped glandular cells that make mucus. The squamous columnar junction, also called transformation zone, is the border where the endocervix and ectocervix meet. Most cervical cancer begin in this area. Cervical cancer are named after the type of the cell where the cancer started. The two main types are squamous cell carcinoma. Most cervical cells, up to 90%, are squamous cell carcinoma. This cancer develops from cells in the ectocervix. Adenocarcinoma, cervical adenocarcinoma, develop in the granular cell of the endocervix. Clear cell adenocarcinoma, also called clear cell carcinoma or mesonephroma, is a rare type of cervical adenocarcinoma. Okay, next. Okay, let us start with our case. What is adenocarcinoma of cervix? It's a type of cervical cancer that occurs in the cell of the cervix. The cancer starts in the gland cell that produce mucus. The cervix has glandular cells scattered along the side of the passage that runs from the cervix to the womb. Adenocarcinoma of the cervix not only affect deeper, more internal area, with the development of precancerous lesion in the cervical canal that are more difficult to sample, but also tend to asymptomatic and undetectable through colposcopy and it reach advanced stages. Progression of cervical cancer. When cancer develops, the cancer cell grow and multiply and form a tumor. The tumor will start off small and contain within a small area. This is early stage. The tumor can grow larger and spread to the area nearby, which you might hear being called locally advanced. Eventually, cancer can spread to other areas in the body. This is advanced stage. A pathologist or histopathologist will look at sample cell that under microscope to give the cell a grade from 1 to 3. The grade show how different cancer cells are to healthy cells and the size of cell whether the cancer has spread. Next. We go to risk factor. First, human papillomavirus, HPV, persistent presence of any at least 15 HPV DNA type in cervical cell. Use exogenous hormone, long-term use of hormonal contraception. Example, IUCD, exposed to miscarriage prevention drug. Smoking, but this is a cancer promoter. Parity, that means the condition of born child. 5 or more pregnancy. And last is sexual factor of the partner. probably related to risk of HPV infection, many sexual partner, natural history of HPV infection in male. Next. Next slide. We go to symptoms. Cervical cancer is cancer that starts in the cell of the cervix. Cervical cancer usually develops slowly over time. Before the cancer appears in the cervix, the cell of the cervix go to change known as dysplasia, in which abnormal cells begin to appear in the cervical tissue. Over time, if not destroyed or removed, the abnormal cell may become cancer cells and start to grow and spread more deeply into the cervix and surrounding area. Early stage cervical cancer generally produce no sign or symptom. Sign and symptom of more advanced cervical cancer include vaginal bleeding after intercourse, between period or after menopause, watery, bloody vaginal discharge that may be heavy and have a foul odor, pelvic pain or pain during intercourse, unilateral leg swelling or pain, pelvic mass or gross cervical lesion. This is a figure stage that used by clinician of gynecologist and obstetric. Figure stages, we have 4 stages and 5-year survival rates. That's all from me. And for next topic, I pass to my colleague.
Assalamualaikum warahmatullahi wabarakatuh. I am Shahida. Will explain regarding the case study for the adenocarcinoma of cervix cases. So first of all, a 37 years old Gravida 4, Para 4 was referred to the gynecology clinic 16 months after vaginal delivery. Gravida 4 here means this patient's already pregnant for 4th time, and Para 4 here means all the 4 pregnancy is success. Okay, with symptom of postcoital bleeding for a month. Postcoital bleeding here means during sexual intercourse there is a bleeding. Okay, and there was no history of itching or offensive smell. Next, she was in the period of lactations without cycle of menstruations, means she's still breastfeeding, but there is no signs of menstruations. And then the routine smear test and screening for high-risk HPV tests were test negative 3 years ago. The general practitioner referred the patients to the gynecology clinic after finding an abnormal cervix when he intended to take a smear. Next, the gynecological examination revealed a vegetative mass protruding from cervical canal to vagina 4 times 3 cm in diameter. In the ultrasonographic examination, uterus was retrovered in positions, myometrium was homogeneous, the thickness of endometrium was normal, and intrauterine device was seen in the uterine cavity. Means the tumor was detected during the screening by the GP. Magnetic resonance imaging (MRI) show a suspicious hyperintense solid mass arising from posterior lip of the cervical canal reaching the fornix. Next, the final pathology result. The result was consistent, showing moderately differentiated endocervical carcinoma originating from the cervix. The tumor size was 4 times 2.5 times 1 cm. The depth of tumor in the hysterectomy specimen was 1 cm. No parametrial invasion was detected. There was no invasion to uterine corpus or vagina. 30 lymph nodes were extracted and no evidence of metastasis to the lymph nodes or lymphovascular invasion. Means it is still a benign mode. Okay, for the discussion, cervical cancer is the most common cause of cancer-related death. The squamous tumor occupy 80% of cervical cancer, and the majority of the rest are the adenocarcinomas. This case is one of the examples of mucinous endocervical adenocarcinomas, which account for 70% of all cervical adenocarcinomas. The durations of progression is thought to be 5 to 13 years, during which oncogenic virus infections of the cells in the squamocolumnar junctions of the transformation zone leads to the proliferations of atypical glandular cells. The rapid onset cervical carcinoma is very rarely seen in this situation. This is defined as the diagnosis of invasive cervical carcinoma following the normal pap smear in the 3 years. Means this patient have a normal pap smear, but after the fourth pregnancy, they develop a tumors. Okay. Next, the diagnosis of invasive cervical cancer detected that rapid onset cases tended to be younger than normal onset ones. Thus, this case is classified as rapid onset cervical carcinoma. The patient was pregnant 16 months before the diagnosis and no microscopic examinations was done. Okay, this is the laboratory analysis that we have done for this patient. The first one is the cervicovaginal cytology. This is a screening test that has been made by the patients. And then TIMPREP also made by the patients. The TIMPREP have the greater sensitivity and specificity in detecting lesions, low-grade squamous cell lesion, high-grade squamous cell lesions, and glandular lesion, as well as subsequent usefulness for detecting HPV through molecular techniques. Next, biopsy. Once the tumor appears, we take the tumor and do biopsy. Paraffin blocks were processed by classical histological technique using hyoscine and eosin stain. For more detailed histopathological investigation, was stained with Mason trichome kit. And then we do the immunohistochemistry, the nuclear and diffuse cytoplasmic expressions of P1CINK4A in a squamous cell carcinoma of the female genital tract are extremely accompanied by high-risk HPV infections and neoplasm of cervical origin. This is the histological features of the biopsy. As you can see, the cervical adenocarcinoma, there is a mucinous endocervical type. If you can see here, there is a well-differentiated tumor with prominent tubular gland pattern. All right. So next, move to the cytology features. As you can see here, the cancer cell population showing irregular aggregates with elevated disorganizations and individuating cell scattering. Okay, so this is the cell that is aggregates and scattered around the cell. Okay. Okay, next, move to the next presenter, Muhammad Harid. Thank you.
Okay, Assalamualaikum and very good evening. Okay, I will continue to present about the characteristic of each level in cancerous cases. First of all, we have 5 type of category, which is we can see in the slide, ascus, which is atypical squamous cell of undetermined significance. Ascus refers to the presence of squamous cells that show slight abnormalities, but the change do not meet the criteria of definitive diagnosis of low seal or high seal. Ascus can have a various causes, including benign condition, inflammation, or HPV infection. It is considered an inconclusive result, and further testing or follow-up is typically recommended to determine the appropriate management. So for the second one, we can see the ascus high or atypical squamous cell cannot exclude high seal. Is a category when the atypical squamous cell present in the cervix cannot definitely be categorized as high-grade squamous intraepithelial lesion, high seal, but there are features suggesting a higher grade abnormality. Ascus high indicates a higher degree of concern compared to ascus and usually warrant more immediate follow-up and evaluation such as colposcopy and biopsy to assess for high seal or cervical cancer. So for the third category, which is a low seal, we can see that low seal indicates that the presence of mild cellular change in the squamous cell of the cervix. It is often associated with HPV infections. Losil is considered a precancerous condition, but it generally has a lower risk of progressing to cervical cancer compared to high seal. And we can see in this picture when it's different between low seal and high seal is the characteristics. So for high seal, indicates that the presence of moderate to severe cellular abnormalities, which conclude high NC ratio, irregular cells in the squamous cell of the cervix. Similar to low seal, high seal is usually caused by HPV infection. High seal carries a higher risk of progressing to cervical cancer if left untreated compared to low seal. And last but not least, the squamous cell carcinoma is the type of cancer that we can look the feature at the picture, which has high NC ratio, hyperchromatins, and we can see also the distorted glandular architecture, nuclear abnormalities, and also hyperchromasia. Next slide. Okay, for the patient management, for these cases, cervical cancer treatment are included surgery, chemotherapy, and radiation therapy. If your doctor says that you have a cervical cancer, you can ask to be referred to gynecology, oncology, or ONG specialist uh, for the further treatment plan. So there are uh, there are there are several types of treatment that can be treat for cancer patient, which is surgery, chemotherapy, or radiation. For surgery, surgery plays a significant role in the management of early stages. In these cases, the surgical option may include radical hysterectomy. This procedure involves removing the uterus, cervix, and surrounding tissue, such as the upper part of the vagina and lymph nodes. Second is trachelectomy in selected cases where the tumor is confined to the cervix and small in size. A trachelectomy may be considered. It involves removing the cervix while preserving the uterus to allow for the future fertility. For the second one is chemotherapy. Chemotherapy is a type of chemotherapy is type of treatment that use drug to kill cancer throughout the body. It may be administered before or after surgery or in combination with the radiation therapy. Chemotherapy is often recommended for advanced stages of adenocarcinoma of the cervix or when there is a risk of the cancer spreading beyond the cervix. And for radiation therapy may be used as the primary treatment for locally advanced adenocarcinoma of the cervix or in combination with surgery. It's involving delivery high energy radiation to the affected area to kill cancer and shrink the tumors. External beam radiation therapy and brachytherapy internal radiation are commonly used technique. So for the follow-up testing during and after the treatment, some of the tests that we were done to diagnose cervical cancer or to find out the stages of the cancer may be repeated during the treatment to see how well the treatment is working. We can use a tumor marker in chemistry lab to detect the level of the tumor. Decision about whether to continue, change or stop treatment may be based on the result of these tests. Some of these tests will continue to be done from time to time after treatment has ended. The result of this test can show if your condition has changed or if the cancer has recurred or come back. These tests are sometimes called follow-up tests or check-up. So tell your doctor if you have any following signs or symptoms which may mean the cancer has come back, or vaginal bleed or discharge, pain in the abdomen, back or leg, swelling in the leg, or trouble urinating, change in your bowel movement, cough, feeling tired. Also, when the patient has this symptom, they might be tell the doctor so the doctor can find out what is the problem that the patient has. So for the cervical cancer, follow-up tests are usually done every 3 to 4 months for the first 2 years, followed by checkup every 6 months. And then the checkup includes a current health history and exam of the body to check for the signs and symptoms of recurrent cervical cancer and for late effect of the treatment. PET test may or may not be done during your visits. So these are several type of the patient management that we can apply to the patients. Okay, so next, so for the conclusion, I will have several points that can be concluded uh, for this topic. Cervical cancer is a type of cancer that occurs in the cell of the cervix, which is the lower part of the uterus that connect to the vagina, and the most common cause of cancer-related death. The squamous tumor occupy 80% of cervical cancer, and the majority of the rest are adenocarcinomas. This case is one of the example of mucous endocervical adenocarcinoma, which account for 70% of all cervical adenocarcinomas. Various strains of the HPV, human papillomavirus, a sexual transmitted infection, play a role in causing most cervical cancer. So when exposed to HPV, the body immune system typically prevent the virus from doing harm. In small percentage of people, however, the virus survive for years, contributing to the process that cause some cervical cells to become cell cancer. Early prevention of cervical cancer by undergoing a screening test and receiving the vaccine that protect against HPV infection. So that's all for uh, and these are the reference. So that's all for our presentation. Thank you very much and Assalamualaikum.